Hey NPs, were you unable to attend the NCNP Fall Virtual Event livestream? If so, we've got you covered with NCNP On Demand. You can view all of the recorded livestream sessions until January 18th, 2024 and earn 55 CE credits and 30.5 advanced pharmacology hours at your own leisure with NCNP On Demand. Register today.
In this episode of the Nurse Practitioner Podcast, Dr. Victor Czerkasij discusses over-the-counter dermatology treatments for underinsured and non-insured patients. Today we'd like to welcome Dr. Victor Czerkasij, Doctor of Nursing Practice in Dermatology. Dr. Czerkasij serves his patient population in Tennessee and is very busy in research, writing, and speaking at many conferences. It's great to have you back on for another podcast, Dr. Czerkasij. Dermatology remains one of the more popular topics across various specialties. It seems everyone wants to know more about what happens to be a rather large and complicated topic.
Thanks as always. I'm happy to take some time for this NPJ podcast, and I'm ready to go.
So I understand that today we have an unusual topic. In the past, you've covered familiar areas such as acne, psoriasis, and rosacea, to name a few. But today I understand you'd like to cover the area of over-the-counter medications in dermatology. So first, why even talk about over-the-counter medications for providers today? And how does dermatology play a part in it?
Well, thank you for asking that very good opening question. We have right now in America over 100,000 over-the-counter products on the market in the United States. It's really over the top. They have about 1,000 distinct active ingredients that have generally been approved by the FDA. They cover dozens of therapeutic areas. For example, you might be sitting there just thinking of these yourself. Musculoskeletal pain, headaches, cold symptoms, allergies, heartburn, sunburns. How about hair loss or tooth pain? I remember Ambisol when I was a little kid when I had teething pain. Fungal infections, skin tag removal, acne. That's a big one. Rosacea, seborrhea. Skin lightening, and it just goes on, and people are wondering what works, what's the research, what's the ingredients, how long do I use this, is it only a recommendation from my neighbor? So it's a pretty stressful landscape for a lot of people. Consumers are not always clear on dosaging or the interactions or how long they're supposed to use it. Providers like myself, we're not always clear as to what's happening in the background. And is it creating new problems, or does it interact with any medications that I happen to be prescribing? What about pharmacists? I have a small bone to pick in this podcast today with pharmacists because they'll sometimes make recommendations on our writing, or they'll comment to the patient, or I've been told by the patient that the pharmacist directed them to a certain aisle if they complained a little bit about the cost of the medication that I had written. Is that negating my authority? What are the ethics in regarding to that? What about if the patient comes back and says they weren't better and they didn't check with me first? Or what about the patient themselves who kind of shrugs their shoulders and says, well, I want to save money. Let me go ahead and Google this, but they don't have any experience or training outside of Google. So these are real issues, and I don't want to belabor the first point of your question, but dermatology plays a role because we happen to have the most common ICD-10 code in the United States on a daily basis. About 33% of all codes that will be diagnosed every single day in America are from dermatology. We only make up 1% of the healthcare provider population, though. And look at Americans. They're experiencing at least one active skin disease at any given time. About a third of them are experiencing one active skin disease at any given time. So that's really a remarkable thing. General family medicine is first in advising over-the-counter use, followed by pediatrics, but still dermatology, we are number one in advising over-the-counter. And we don't see any observable difference in the research of suggestions by providers when treating gender or race. It just tends to be down the line.
I hadn't considered all of this and its significance. Thanks for sharing, Dr. Czerkasij. Now, what are some of the more popular OTC products in America? It seems that when I'm visiting a drugstore aisle, it's not just dermatology products.
Yeah, so let me give you what Americans are wanting to treat in their lives. So I mentioned some before, but they're looking at vitamin supplementation. Fish oil, for example, is a part of that, using probiotics. There's aspirin, So people know that it thins the blood, so for stroke prevention, but do they know if it's 81 milligram or 325, or do they take more than that? We also have erectile dysfunction, and people are looking for that to have treated. And you'll see advertisements now, direct to consumer on television. Skin rashes is very common. Everyone's using tea tree oil or essential oils now. And there's even on Amazon. I know this is remarkable, but I have seen skin cancer creams on Amazon that you can purchase that'll arrive to your home. And these acids, I'll say on the one hand, they work, right? But a grenade would work also. In other words, these things are uncontrolled. Once they touch the skin, they just burn right through to the bone. And this is over the counter. The most common used over the counter medications are acetaminophen, ibuprofen, aspirin, and pseudoephedrine, hydrochloride. So that's not a surprise. And then other popular things that people might not consider is like sunscreens, or benzoyl peroxide, which is in acne. There's salicylic acid. Hydrocortisone creams are really popular. You've got all kinds of antifungals. And I would mention, of course, the antibiotic creams, polysporin, triple antibiotic, and one that consistently ranks in the top 3 by the American Contact Dermatitis Society. Can you believe it? There is an ACDS, and they have in the top 3, the most popular product, I think, is Neosporin. Everybody's using Neosporin, and that is a huge problem for over-the-counter rashes. So, yeah, dermatology is a part of it. And when I'm in the drugstore aisle, everybody's looking for everything.
This is all good to know. Thanks for sharing. Are there problems with OTC medications, and how would the public become aware of this?
Yeah, so here's a common one. Not being able to differentiate, for example, a patient between something that's inflammatory, right? Like, let's say, a poison ivy or a latex or a nickel dermatitis versus a fungal. They just see a red rash. And what do? Well, it's a red rash. I'll go get over-the-counter hydrocortisone, right? It's a class 7. We have 7 classes of steroids, and one being the most powerful, but you can get class 7 over-the-counter. What if they do get steroid and they put it on what they think is poison ivy, but really it's ringworm? It's a fungal infection. Well, steroids worsen true fungal infections. So right there, the public needs to know what they've just done is just made things worse for themselves. This is a real problem with over-the-counter, and the public isn't aware. Let me give you another one. Everybody that comes in and tells me that they have nail fungus because their nails are crumbling white. Okay, so every person in America, I've got nail fungus. Well, 2 studies came out during COVID, which, of course, they kind of got buried because of all the issues going on in the media and in healthcare at that time. And so these 2 major studies, having 3,000 plus participants in each one of them, found that nail fungus was only found in 30% of the cases. Well, wait a second. What does that leave? Well, 60% of the cases were bacteria, and then 10% were just common keratinization. That's a huge thing to know, and the public is not aware, and I don't think a lot of providers either. This is why right now I always biopsy when a patient is concerned about nail fungus, because I'd like to know what it really is. Another thing is people confuse skin cancers with a boil or a skin tag or a wart, or I have statements like, I got bit by spiders. Well, you would think that arachnophobia, if you remember the movie, was about spiders attacking a home and they're everywhere. But, it's not that. And it could be something psychiatric, like delusions of parasitosis. It could be inflammatory autoimmune disease. It could be prurigo nodularis, a form of eczema. This is why we went to school. This is why we're professionals. And we want the public to be aware that it does take someone like ourselves to do a better job in assessing what their problem is so they'll get treated more safely and effectively. Some things that are over the counter doesn't mean that they're without pitfalls. I was just thinking, there was just last year a case in Texas where there was mercury poisoning from bleaching creams that were imported from Mexico, and they resulted in severe neurologic damage in the people who used that. We have real concerns over dietary supplements and weight loss products right now. They have some lasting adverse effects. People are worried about chemical sunscreens, the ones that do absorb. We don't have really good direction from the FDA right now. What's the developmental effects on children? Is there carcinogenity, reproductive? So we just don't know. There was another case that I was reading in the news not too long ago. There were some imported over-the-counter products that touted steroid benefits. They were actually class 1 clobetasol 0.5, which is a class 1 steroid. So imagine using that, thinking it's over the counter and getting atrophy and stria. So that was from China, some products that slipped in and they were in Los Angeles. So yeah, to answer your question again, how does the public become aware of this is me talking about it right now and certainly encouraging folks to go see a professional.
That's some eye-opening information for our listeners and their patients. As a provider, how do you engage patients in discussions with OTC use? Is it enough to just ask what a person is using? How does a conversation sound so our listeners can get an idea?
Oh, okay. So this is good because it allows me to kind of role play. Now, what we rely on, first of all, of course, is the medical history form, which we always ask patients across the spectrum to update, right? Regardless whether you're family or pediatric or endocrinology, you always ask the patient, what are your latest medications and, what are the things that you experienced in health that we need to know about, your blood pressure, anxiety, depression, kidney stones, things like that. Now, I will go and use that medical history form to confirm. I'll say, is there anything else that's been left out that you might be using that I need to know? What are you using? And how much of that and for what condition? And that's when we probably will get into the supplementation. Now, don't get me wrong. I use vitamin supplementation. I'm 62 years old in just a few weeks. And I do take vitamin D supplementation because we know for a fact that we lose it. And I do have blood work on a regular basis so that I don't become toxic. I also use a probiotic every day. And I use vitamin C, which is water soluble and, it can pass through very easily. You don't build it up as a fat. So I ask the patients what they're taking, and because there are certain things that can interact. Now, how long have you been using it? Where are you using? Now, you might think that's a strange question, but it could be a topical that they're using on their skin, right? Maybe there's something for earwax, or maybe it's nasal. It's not just oral. And do you use it in combination with any other product, any other of your medications? It's surprising how many times when I ask someone, hey, are you using any medications? I don't use anything. And what they really mean is maybe prescription. But, we have to kind of clarify that. Here's another one I ask. This happens almost every visit. I'll say, do you have this medication we've given you in the past? Yeah, I still do. But that was 4 years ago. Well, yeah, I just use it when I need. Have you noticed if it's expired? It's on the crimp. I think it's probably done with by now. And people try to make medications go as far as they can. I also encourage patients to please bring to me what you're taking so I can get a good idea. And it's not uncommon for me to open 2 Ziploc bags and just kind of line them up, all the tubes and all the bottles. And this gives me, again, an idea as a provider to start the conversation, and having a provider listening right now kind of give you an idea. Here's one more that I throw in. Do you have children in the home? And they'll say, well, no, I'm a grandparent. Well, I said, do you have children come over? Well, yeah, I have my grandkids come over on the weekends. All right. Is what you have and what you use tamper-proof? Do they have access? Do you know where the medications are so the kids don't run across them? And generally, these are accepted very well, these lines of questioning, and certainly it provides for a better conversation.
Thanks for sharing those conversational tips. So in all this, where does the FDA fall in? What is the regulatory landscape like in America? Do you have confidence that the public is receiving protection and that providers can have confidence in recommending OTC products?
Well, on a personal level, I feel that the Food and Drug Administration, our FDA, is doing a good job. I find that it's probably quite overwhelmed simply because of American technology and ingenuity. We have so many medications that are being created by so many pharmaceutical companies and labs for any number of conditions. We have things that were orphan diseases in the past, and now, thanks to the experimentation and the scientific evidence coming from looking at these diseases on a molecular level, they're coming up with some fantastic medications that we didn't have just 10, 20 years ago. Very safe and targeted. On the other hand, that allows, with limited resources, areas like over-the-counter to get short shrift. So the FDA does have oversight for over-the-counter, And they classify it as, number one, is it safe and effective for what it's claiming to do, right? In other words, if you say this is for toe fungus, does this product with its ingredients at least show some efficacy, and I don't know all the percentages, and is it safe so that you can buy this over the counter? Number two, things that are not recognized as safe and effective, so they don't allow that to at all be allowed. And there are some glaring holes, as I mentioned, in skin cancer products, treatment-wise on Amazon. And then, of course, there's number three, which is, well, we're on hold with this. We need additional data. So what they try to do is they look at purity, right? Make sure there's no contamination in the product, and that any kind of filler or dye or buffer or wax or vehicle that they're using, whether it's foam or lotion or cream or ointment, is free of, bug parts and things like that, or chemicals that could hurt you. I'm sure it's a bigger list than I can think off the top of my head. They look at potency as number two. So purity is first, potency is second. Like, what's the strength of the drug in the grams or milligrams or micrograms, right? And they do use it in animal studies, and people are not happy about that. I understand certain sectors. But on the other hand, we're not going to use babies or children. So yeah, that's an ethical dilemma, but that's how they do it. So is it delivering the amount of medication? A third thing after purity and potency is bioavailability. What does bioavailability even mean? Well, when you take the medication or apply it to your skin, what kind of drug absorption occurs? Is it transported to where the area of action is, right? Like, let's say it's, poison ivy again. We'll pick on that. So they try to measure the concentration then later in blood and tissue in experiments. Fourth is efficacy. So do you get that desired effect in a patient regardless of their race or their age or their weight or their gender or any other kind of dynamic? So if you're a 65-year-old, 200-pound white woman, you should have just as much efficacy on that condition as a 21-year-old Hispanic male who's 110 pounds, right? So that is what they look at, and they don't want any kind of fluctuations. And finally, purity was first, potency was second, third was bioavailability, fourth was efficacy. The fifth one is safety and toxicity. And those two go together. And this is where lab animals, again, are tested early on, and then they give attention to pregnancy and lactation. So they do use mammals to find out if it does affect pregnancies and lactation, because if it's an over-the-counter, you can have a pregnant woman come along and take it, and what would that mean to the developing fetus? So, yeah, the FDA, in your question, where do they fall in, and what is the regulatory, and do I have confidence? I think they're doing the best that they can. Just remember, all medications, every medication, whether it's prescription or whether it's over the counter, can be considered toxic if not taken correctly. Just because it's over the counter. And I'll give you an example. I was 4 years old, and my mom had a bottle of, this is in the 1960s, had a bottle of what was called St. Joseph's aspirin, right? It was orange-flavored aspirin. Well, I'd fake having a headache so I can get that aspirin. One day, she wasn't around. I took the whole bottle. And as a child, I remember going to the emergency room, and, it's kind of hazy, but I wasn't happy with whatever they did to get that all out of me. I just knew that it tasted delicious. And of course, we didn't have those tamper-proof sealed containers like we do today. So even if it's over the counter, it can be considered toxic if not taken correctly. And that's a great example, and it can still happen. So really what differentiates a therapeutic treatment versus someone dying is dosing. And we have to be very, very careful. And that's why we need an oversight like the FDA.
Thanks for sharing those insights, and we hope things continue to improve for both patients and providers. So it doesn't sound like the system is perfect. Are there some glitches, and have you experienced any yourself?
Yes, and I almost hesitate talking about this because I don't want to give anyone any ideas. But my assumption is the people listening to this podcast are professionals like myself. They're providers doing the best that they can. And the podcast is designed to stir up some conversation and get people thinking and be prepared if they should have an issue. And so let me tell you one, maybe two very, very interesting little things that I've run across that maybe will explain or illustrate how the system is not that perfect, and we do have some glitches. So the real wrench in the works right now is our pet stores and also farm feed supply places. And this happened during COVID in particular, where it really came to light. There are some, and I put this in quotes, savvy consumers and some unethical providers who've long known that antibiotics, antifungals, antiparasitics are easily available without a prescription at farm supply outlets and pet stores. So I've kept aquarium fish since I was a little boy. I just can raise fish and breed them. I love tropical fish. And I know, and I remember it hit me even before this issue came up during COVID, when people did not want to come out and go see providers, and there were some providers that closed down. We never did. We were open every day during COVID. We just, masked on and kept going. And well, some people went ahead and purchased these antibiotics or antifungals or antiparasitics in the farm and feed stores and pet stores because it's exactly the same product as you would have for a human being. I mean, it's no different, right? It's penicillin, it's amoxicillin, it's ketoconazole, it's sulfa, and ivermectin, So people were using this product that was designed for animal for human. And while it is generally the same product as in a prescription, we want to avoid the temptation to ever encourage anybody who is underinsured or uninsured. We have tried in America to help people the best that we can, depending on their income, for example, of what they're going to pay for insurance. And that's why over-the-counter conversation today is so important, so that we can give our patients some great options over the counter. But we also have to be very, very careful that we direct them to what we know is regulated, because regulated gives us safety, and safety gives everybody a good day. Let me also mention one more thing. I think maybe people have picked up over the years who have listened to me on podcasts or seen me speak at a conference or met me. I'm Ukrainian, right? So nobody ever knew what Ukrainian was until recent events. Now all of a sudden, there we are. But where I am in my community, there's a very, very large Ukrainian immigrant population. And we're happy to have the thousands that have come in, and they've really been a positive addition to our community. But all of a sudden, we have these entrepreneurs, and we are very natural entrepreneurs, Ukrainians. They're mixing products for many ailments, and they're selling them among friends, fairs, cultural events, their churches. And I've been approached by a few who have said, hey, you're well known in the community. You've been serving here 25 years. We would love to have your endorsement. Here's some free product for you. We want you to try it. Well, this is a very uncomfortable place for me because they're beautifully labeled. They're really well packaged. And of course, it's all in Ukrainian, very little English. And I'll go, well, tell me what this is for. And how have you mixed this together? Are the products pure? Where have you got the products from? What purpose is it really serving? It says here on the label that my goodness, it's for, bacteria and fungus and virus. And this is also for colds if you put it up against your nose. Now, what was the research that was done on this? And, I've had some pretty uncomfortable encounters because they're kind of hurt. They want my approval. They want me maybe even to sell from my office. And I'm like, no, we just don't do that here in America. And I have to educate them. And that's happening. We have people coming from other countries besides Ukraine that are used to their ethnic, natural, tribal forms of treatment. And I'm not against it. In fact, I'm very culturally open to lots of things. My wife tried cupping recently for hives, and it really, really worked. If no one knows what cupping is, it's heated vacuum glass tubes, which really give you some relief on the surface of the skin from itching, and it beats using steroid. But we have to be very, very careful about recommending over-the-counter products and understanding that we have to be very ethical and careful.
Thanks for sharing some of your personal experiences with us. During your day, how often do you recommend OTC products, and for what conditions are people looking for assistance?
Well, we did mention earlier that we have all kinds of over-the-counter recommendations that we can give. I would say acne and rosacea, fungal, hair loss are probably our biggest over-the-counter or issues that people are looking for, medical problems, and they're looking for an over-the-counter. I understand that about a third of all Americans are experiencing at least one active skin disease at any given time. And this is causing folks to really look for that assistance. So I do my very best to understand what the broad categories are of the anti-inflammatory, right? The anti-infectives, I would call them. We look for acne and seborrhea. Now, interestingly, I might add that there's a lot of things that used to be prescription that are now over the counter. Benzoyl peroxide, for example, is a classic example. I think that was about 7-8 years ago, was prescription. Now we can get all kinds of formulations over the counter. Antifungals. Then, of course, analgesics. People always find for their pain something that they're going to use, and that's probably why we have such a terrible fentanyl problem in America as well, because they crack down, the DEA especially, on any pain writing in America. But, it's like water. You squeeze water, it slips through the fingers, and we've had that as well. Anti-itching. Itching is one of the biggest areas, especially scalp itch, and people are driving themselves crazy looking for the best thing. People are always looking for cleansers and soaps, certain shampoos and conditioners, which will allow them maybe to grow hair, thicken hair, and of course the sunscreens. I'm being careful in this podcast that I don't maybe mention too many things by name. I don't want anyone to think that I'm endorsing something, nor do I want to get in any ethical trouble by using my personal to down anything. I did pick on Neosporin because certainly the American Contact Dermatology Society it's a part of the American Academy of Dermatology. They are pretty public about that. But other than that, I would say that those areas that I mentioned is where folks are really looking for help.
It's interesting to hear those conditions and what folks are looking for help with the most. Where does a provider gain experience in the use of OTC products?
Well, I would start by what is the history of the medications that we're writing. For example, ketoconazole 2% cream is an excellent product that was prescription since 1967. We still use it, and it's required to have a prescription, but not ketoconazole 1%. So some people might say to themselves, all right, this is not very aggressive ringworm. I know that it's ringworm. I did a scraping here in the office. Person doesn't have prescription insurance. Go ahead and recommend ketoconazole 1%. Did you know that ketoconazole 1% also comes in a shampoo? So it'd be great for seborrheic dermatitis. So there's one example of how you get to know how these work. So I will go myself to the pharmacies, and I will stand there in the aisle for some time, and I will see what they have. And then I'll go ahead and explore. I might add that there's a lot of resources, which I'll maybe hopefully give you toward the end, that can help you toward these different conditions, and you'll be able to get more experience. So I also noticed that many medications that have gone generic, they'll also go from generic to different percentages to over the counter. So again, just follow the history of a medication and be aware yourself what's available in the community that you can safely recommend to your patients.
Some more valuable information for our listeners. I understand you once had some trouble doing your own OTC research.
Oh, yes. So one time I was in an aisle and I was probably there for about 25 minutes. That's a long time to be in a pharmacy, and I had a small pad of paper, and I was going up and down the aisle into the broad categories for steroid, for antifungal, for hair growth, and I was just kind of marking what they had available and what the prices were so that when I recommended to a patient, I can tell them knowledgeably, truthfully for the most part, that they have something available that while their insurance may not cover or their insurance only covers a few of those items, they can probably get just as good a result there in the aisle. Now, this was a pretty large pharmacy at a department type store, box store. And I noticed that there was a lady near me that she just kept kind of hovering by me and kind of giving me side glances. And I just kind of would get out of her way, and I kept on with my job. Finally, she turned and confronted me, and she whispered something in her lapel. And on either aisle, there were very large men with jackets that were kind of blocking my way. And she wanted to know immediately who I was, what was I doing, and if I needed to be escorted out. And I just was so surprised. I started laughing. I said, wait, you must be store security. She said, yes, but you haven't told us what you're here for. I said, well, I'm a local doctor of nursing practice. I work in dermatology for the last 20 plus years in this community. I said, in fact, right now, if you'll turn to the pharmacy people, I'm going to wave at them and they're going to wave back because I write so many prescriptions. But what I do for my patients is I recommend over-the-counter products, and I'm just getting an update here, what you have available, what the prices are. And, you could see that they were kind of calming down, and I'm not exactly your example of a clever criminal. I said, look, here's all my paperwork. I'm showing you the prices and what I want to recommend to our patients. Oh, well, they felt a lot better about that. And so that was my little story about nearly getting arrested there, or taken at least in the back and questioned some more as to my suspicious activity in the over-the-counter aisle at the store.
Do you have any final thoughts to share, Dr. Czerkasij?
I do. I want our providers to be aware that there's kind of a new paradigm. I don't know if it's a new opportunity or it's more of a dangerous, unregulated trend. And I'm noticing more and more, and I mentioned this early in the podcast, where our pharmacists are very strategically positioned, I would say, as gatekeepers into the healthcare system, especially for our self-medicating patients who want to continue with over-the-counter products. And I'm noticing more and more, and I'd like to research this on my own, but I'm trying to find out what are the ground rules for our pharmacists. Is this a substantial business opportunity, I'm asking myself, or is this something that's getting a little bit unregulated? I noticed that they're switching prescription to non-prescription on a regular basis. I say regular. It's happening a couple times, 3 times a month. And I talk to the patient about it, and I am perfectly comfortable to pick up the phone and I call and talk to them, because I think that there are some liability issues with this, with our local pharmacy friends. And when they switch a prescription to a non-prescription, that kind of goes back to our earlier discussion on FDA purity. What are the ingredients? What is the route? I think there is a difference between lotion and foam and cream and ointment. And sometimes they'll say, well, it was only like a 5% difference. Well, that's 5%. That means something, especially when it's only 1% between some over-the-counter and prescription products. So again, what are the pitfalls? What's the liability? What are the consequences to the patient, the pharmacist, or me as the provider if I find out about that? So I try to be very careful in how I address that in front of the patient, right? I don't want to start bad-mouthing and getting a poor reputation in our community. On the other hand, I have responsibility. And so do all the providers that are listening in. One thing I might throw in, and I don't want to take too much time today. I know people are needing to go, and you don't have necessarily a 40-minute drive to your job, and you're listening in. But if you want some resources for good over-the-counter products, right, there's a real deep dive on a database that you might want to use called ewg.org/skindeep. So that's ewg.org/skindeep, and you can find a database of more than 85,000 personal care products and their ingredients. Food and Drug, right, Administration. I would go to fda.gov. They have lots of updates on a lot of products. I also think there's some excellent textbooks out there, and I have no connection with any of these authors, no kickback. I don't have any relationship. But there's one called Comprehensive Dermatologic Drug Therapy, the 4th edition. It's 2020. It's called Comprehensive Dermatologic Drug Therapy by S.E. Wolverton and J.J. Wu, spelled W-U. This book is fantastic because it has such great over-the-counter lists on the mechanism of action and efficacy, pharmacology, what kind of adverse events you have, and ingredients. The other one, going back to contact dermatitis, is Fisher's Contact Dermatitis. And that's by J.F. Fowler and M.J. Zirwas, which is Z-I-R-W-A-S, 2019. Fisher's Contact Dermatitis, 7th edition, has a wonderful section on over-the-counter options for all your prescriptions. So, I think these are great resources, and I would definitely consider looking up these books. Sometimes your employer will offer a textbook or two a year, or they should, for educational purposes, and you might want to use those.
Thanks for your time, Dr. Czerkasij. We always appreciate having you on the podcast.
Thank you.
For more great content from the Nurse Practitioner, be sure to visit us online at tnpj.com for the latest NCPD articles, columns, and much more. Please leave us a 5-star review on iTunes and Spotify, as it helps with the podcast's visibility and helps us to keep bringing you this great content. Also, don't forget to follow us on Facebook, Instagram, and LinkedIn at the Nurse Practitioner Journal, and on Twitter at TNPJ_journal. Thanks for listening. This podcast does not constitute medical advice and should not be taken as such, and does not replace professional judgment or advice. The ideas and viewpoints expressed on this podcast do not reflect the official position of the speakers, authors, affiliated organizations, the Nurse Practitioner Journal, or Wolters Kluwer. Please note that the hosts of the Nurse Practitioner Podcast are not clinicians. However, we created the Nurse Practitioner Podcast to bring you relevant clinical information by NPs for NPs. Thanks again for listening.